Hello my lovely people, good morning. You're welcome once again to my channel. If you're seeing my face for the first time, my name is Tina Isoa. I'm a YouTuber based in Owerri, Nigeria. So if you have not subscribed to my channel, please consider clicking on the red subscribe button, turn on the notification bell as well, and give this video a thumbs up. And if at the end of the video you find it interesting, or you have questions, or you have comments to put down, please do not hesitate to put that down in the comment section. Okay, thank you. So today I just want to talk about IVF tips that helped me and tips that can help anyone that want to go for IVF, or if you have gone before and you want to go again. I am sharing a little from my work experience as a health worker and more of the experience. I actually went for IVF 3 times. I did 3 cycles, which I have equally shared the video. I have shared episode 1 and 2, so you can check those ones as well, so that you understand from my angle. Okay, so I'm going to firstly talk about a little overview about IVF and how the whole procedure goes. And IVF, as it is called, is in vitro fertilization. In vitro fertilization, there are a lot of procedures that can help one achieve pregnancy, but in vitro fertilization is a process which helps couple, or a procedure which helps couples to achieve pregnancy, hence procreating, having their own children. So, and there are a lot of things that can lead one to going for, suggesting or thinking on going for IVF. Firstly, if you're not able to achieve pregnancy on your own, maybe you have been married for 1 year, 2 years, 3 years, depending. Professionally, you'll be advised to wait for 5 years. That is if both couples are less than 35 years of age. But if you are both 35 years of age, I think a year, 6 months is enough for you to start considering help or assistance towards achieving pregnancy. So there are causes, things that can make one to consider IVF. Firstly, if you're not able to conceive on your own, if there is, for the woman, some women do not normally ovulate. So if there is lack of ovulation in the woman, you're not being able to produce egg, this is another reason why you should consider IVF. That's if you have tuber blockage, your fallopian tubes are blocked, you should consider IVF. Another thing is fibroid. There is a fibroid, even though that they can be removed through surgical procedure. But if at the end of the day, as a woman, you have done all you needed to do, treat infections, and yes, practically done everything with the help of your physician or the gynecologist, and you're not able to achieve pregnancy, hence you have to consider going for IVF. And for the man, what can actually make couples to go for IVF, if the man is the case, is that if the man has an issue of infertility that is related to oligospermia, azoospermia. That is, azoospermia is whereby the man is not able to produce sperm, that there is no spermatogenesis. He doesn't have that. Yes, he's not producing eggs. And oligospermia is if he's producing eggs, sperm, but is very small, as in the quantity is very small, and is not able to meet up with the egg when the wife or the partner, when the partner ovulates, is not able to meet up with the egg to achieve pregnancy. Another thing that can, there are so many other things that can cause couples not being able to achieve pregnancy, like infection, or even in the man, it can be mobility. If the sperm is not able to swim fast to meet with the egg before it dies off. So these are the things that, or situations that couples can find themselves, and they want to consider IVF. And who can go for IVF? If you are above 35 years of age, like I said earlier, start considering it. And personally, I feel that gone are the days that people will get married and stay 20-30 years before they will now resort to IVF. Even though some will still wait and God will still do it, but I believe that all the whole thing we see in this world that is going on, God knows about them. So if God has been assisting couples, people achieve pregnancy through IVF, so I don't see anything wrong with that. Okay, so, and when you go for, let me now go into the actual, let me give little hints. I think talking about the procedure is going to be like a huge topic, but let me just give little overview about the procedure. This IVF is a process whereby the woman will be subjected to taking drugs, taking injections. That's if after going for consultation and you pay the cycle fees and the other consultation fees and all that. I'm going to make a video about the cost of IVF currently and when I did. Okay, so when you go for consultation, you'll be subjected to a medical examination. Both partners will be subjected to medical examinations, and after diagnosis, if everything is found okay, like hepatitis B, hepatitis C, RVS, as HIV, and so many other things, and they find out that the only way out is IVF, hence you will have to go in for IVF, and the woman will start taking injections to put her body in a position to produce more eggs, after which they will through a surgical procedure, they will collect the eggs and the man will produce his sperm on that day. That is if the man is not azoospermia. But if the man is azoospermia, yes, there is a provision for sperm donors. In every clinic they have that provision. That is if the man at the end of the diagnosis that he was found to have azoospermia as a case, then you can be advised to go for a sperm donor. So but if that is not the case, just like me, that wasn't the case for me. So if that wasn't the case, you will now produce the sperm on the same day of egg collection, and the both egg and the sperm will now be mixed together inside a petri dish in a different cycle, in a different environment, in different laboratory. It's not done casually. So and you wait for like 5 days to 7 days, depending on clinic. They have their own durations to that. But where I went, you wait for 5 days and the eggs will fertilize into an embryo, and you'll be scheduled to come back and get the embryo transferred to you depending on the clinic policy. Some their policies is the maximum they can transfer is 2. Some can go above that. So they will not transfer the egg, and you wait for 2 weeks, that's 14 days, for you to conduct a pregnancy test. If positive, you have achieved pregnancy. But if negative, that means you have to try again. Okay, so that's general overview about IVF. Then the tips that I have to say here now is this. Number one is that you have to believe and accept that IVF is a means whereby clinic or doctors or physicians or health providers assist you to achieve pregnancy. Hence, your maximum cooperation, you have to be there. You need to be mentally, physically, and otherwise ready, and you have to accept it wholeheartedly, that irrespective of the money you are paying, that they are assisting you to achieve pregnancy. Hence, your cooperation is highly needed and recommended. That's the first tip. Okay, so the next tip will be, don't think too much about losing because of the money. Yes, IVF is an expensive procedure. Like here in Africa, it's not even as expensive as what people in diaspora pay, people in developed world pay to achieve pregnancy through IVF. But even if you are in Nigeria, yes, from our own rate and our own belief and all that, is expensive. But you do not don't think much about the money. Just think about the end. Just think about the fact that you're going to see light at the end of the tunnel. That's one of the major tips that helped me and my husband to achieve pregnancy. We are not thinking more about the money. Not that we have so much of a money, but we are looking at how will we feel in the next 1 year that we now have our baby. We have someone we are responsible for. So look at the positive side of the whole procedure, not the money, because it's expensive. That's one tip. Another tip that I'm going to talk about will be, yes, IVF is a painful procedure. Some people will tell you, like I have equally said it in other of my videos, it's an expensive procedure in the sense that giving yourself the injection, impacting yourself with those injections, and this is an injection that you have to take. If you are to take it at 9 p.m., assuming you choose 9 p.m. Every 9 p.m. for that duration of either 30 or even more than 30 days, you'll be giving yourself the injection on that particular at that particular time. Hence, it's not easy, of course, to give yourself to pinch yourself. Is not easy. Talk more of using needle to like inject yourself. So it's actually one of the painful procedures in IVF. Another painful procedure in IVF is the egg collection. On the day of the egg collection, of course, they have equally have an option of egg donors. Yes, they have some people who have egg donors, they have embryo donors. These are all there, but it depends on your case. When you go for consultation after diagnosis and all that, they will advise you properly. So if on the day of the egg collection, it's a surgical procedure which they will go in through your uterus and collect the egg, and after which is actually painful, and you can have what they call OHSS, as ovarian hyperstimulation syndrome, which I had at my first cycle. So that's the painful procedure. That's the painful part of the whole procedure. But for the man, he doesn't have any painful moment. Just to produce the sperm, do the test, that's just it. Another thing I will talk about would be prepare yourself for the whole procedure from the consultation day. Of course, be rest assured that you will be invited to the clinic a minimum of 8 times, for the whole procedure, because they will be checking you, doing a transvaginal scan to know if the walls of your womb is increasing, and at every point in time they are checking you to know how far you have gone. So you have to prepare yourself that yes, this thing is something, and make out time for it. I have to come. If you are working in a place that you may not be disposed, I think I will advise you, or I will suggest that you give them heads up. Tell them prior to commence that, hey, I'm going for this procedure and I will be needing time, because this is not something, it is not a procedure that you decide when to go. Rather, you work with the calendar. If possible, you can take your annual leave. Okay, another thing is to stay focused. During those periods, you need to stay focused on what you want. Don't allow any negative thoughts to come in. Okay, another thing I want to highlight, or another tip I want to tell you, is that if you have been married for 1, 2, 3 years, of course, some people outside may not understand your plight. They will not understand your situation. So I will advise or suggest you tell some of your family members, if not 1 or 2, let them carry you along, and you now know that you have somebody who is supporting you from outside, not just you supporting yourself, helping you in the chores in the house, and probably trying to check up on you. I think you, when you look back and know that someone is there, because why I'm giving this as a tip is that at a point I was feeling down, but my sister was always there to tell me, babe, calm down, think about what you have to, the joy that will come after it. And yes, that's why I'm giving this tip, because I know that for her being there to push me, to advise me, to encourage me, helped me a lot. So I would suggest you put that into consideration too. Another great tip that I'll tell you guys, have you subscribed? Please subscribe, okay? Another great tip I'll tell you guys is this. During day 4, that is after you must have gone for the egg collection and they have transferred the embryo into you. From the day the embryo was transferred, please, I will suggest, mostly for the woman, if you can go to your work, go, because they will still advise you go your normal life. And but the fear, the phobia of I don't want to carry, even to lift the ball pen, will be feeling so as if it's heavy and stuff like that. But whatever be your decision at the end of the day, do not stay alone. Do not be alone at every point in time. Please, because the thinking, the fact that you be alone, is it going to be positive, is it going to be negative, and that can even make one to be hypertensive. So I would suggest that you don't be alone. Get family members, or if possible, yes, go to your work, be busy, so that when you retire home at the end of the day, you just have your bath and go to bed and continue waiting, because that 14 days waiting period is like 14 years, like for real, 14 years. But all the same, the end justifies the means. Another great and important tip, the last of the tips, and the not that is, they are all important, but this one I felt is something that actually helped me a lot, and I tagged them as the 3 P's to a successful IVF result. Was number one, I was positive. Yes, when you go to the clinic for the consultation, there was some good clinics will tell you the truth, not all those ones that will tell you it's 90% success rate and stuff like that. Nobody blows their trumpets when it comes to that. Their rate, their statistics will speak for them. But most health clinics will tell you, they will look into your eyeballs and tell you that it is 50-50 chance. The chances are 50-50, so that you don't feel that you've been cheated or something like that. But aside that, the fact they tell us this, I still was positive, like seriously positive. I was always thinking of the fact that I'm pregnant, and the 3 cycles I did, they were all positive, though I miscarried the first one for a different reason, but they were at the end of the 14 days I was pregnant and I was positive. So you need to, the first P will be, you need to be positive. Positive thinking, positive thought, positive everything that kind of envelope the whole procedure should be positive. Okay, the second P, I call it be patient. Honestly, you need that to achieve it. You need that to succeed, because if you are like in a haste, you want to, even when you go to the clinic, you want to be in a haste to go home, you want to be, that's not going to be a good one. Be patient enough. Even if at the end of the day you did not achieve pregnancy, try again. Be patient. Know that yes, I want responsibility. I want people I can take care of. I want people, I want to have a baby that if I look up to him or her, I know I'm working for somebody. I'm responsible for somebody's health, life, eating and stuff like that. So you need to be patient. It's actually a very patient procedure. You need to be very patient. Okay, then the last of the P's is being prayerful. Whoever you worship, the God you worship, just call on him or her. I don't know if there are female gods. Call on him to continue carrying you along. Be prayerful. Be prayerful. Personally, the my son, I have my son today, he's 4 years plus. The day I was going for an embryo transfer, I went to the church. I knelt down, I called on my God. I said, this is the time for you to do it for me. Do it that I would know that this child is coming from you and that I'm going to be positive and that I will bring him even before I get to my house. I made a lot of promises to God. God didn't disappoint me, neither did I disappoint him with all my promises. So I would highly recommend that you stay prayerful, positive, patient, and being prayerful. So my people, if you have not subscribed to my channel, please consider clicking on the red subscribe button, because there are other good topics that will be coming out from this whole procedure. If you have any question, please put that down in the comment section. If you feel it's private question, do not hesitate to check on me on my Instagram handle and private chat me, DM me, so that I can help you. If I need to assist, I will assist. But if I don't need to, if it's something I cannot be able to help you out, I will still inform you. Never can tell. Please subscribe, give this video a thumbs up, share it with anywhere you think that people will benefit. If you're a content creator, you talk about women's health and as infertility and topics that are related to this, I'll plead that you please help me share it on your community, as well as support me in any way you can support me, so that we can move this ministry to the higher level. Can we see some other time, please? Love you.